Doctor, I have a bad stomachache. I took stomach medicine and it didn't work. Now I feel a little feverish, nauseous.
Don't be nervous. Don't be nervous. Let me take a look for you. Only stomach pain. How long has it been going on? Does it hurt anywhere else?
The stomachache started at 3 or 4 in the afternoon. Now I also have a little pain in my stomach and back.
Does it hurt here? Or does it hurt here?
My stomach hurts here.
Your skin is a little yellow. Do you usually pay attention to the color of your urine when urinating?
The color of the urine seems to be darker recently. What's the matter with a little white stool?
You need to check this before you know it. I'll give you a list. Go for an ultrasound. Look at your common bile duct here. There are stones. Bile duct obstruction can cause yellowing of the skin sclera, fever, and abdominal and back pain.
How come? Why are there stones in the bile duct?
The cause of the formation of biliary stones in adults. Mainly there are the following types of long-term lack of exercise: obesity, high-fat diet. You have an irregular diet, especially if you don't eat breakfast for a long time. Have liver disease, such as liver cirrhosis. The higher the incidence rate with age.
Well, it may be because I often eat and rest irregularly. What should I do with this gallstone?
At present, there are two main methods for the treatment of biliary calculi: surgery and ERCP surgery. Surgery is basically open surgery, according to the situation in different parts, respectively, common bile duct exploration, cholecystectomy, bile duct drainage, and other surgical methods to treat. ERCP is a more minimally invasive treatment. The full name of ERCP is transendoscopic retrograde cholangioplasty. It's an endoscopic injection of contrast agent through the duodenal papilla tube, so the pancreatic ducts are shown retrograde. A technique for introducing minimally invasive instruments through endoscopic biopsy channels for drainage, lithotomy, and expansion biopsy is the purpose. The first choice for the treatment of anterior bile duct and pancreatic duct diseases. However, the treatment of ERCP requires strict control of indications and contraindications. So far, ERCP can be used for the treatment of these diseases. ERCP indications: stones, common bile duct stones, inflammation, suppurative pancreatitis, and other obstruction, parasites, tumors, stones, obstruction of unknown origin, etc. Contraindications to ERCP: 1. Those with severe cardiopulmonary diseases or intolerance to endoscopy. 2. Oral anticoagulation and antiplatelet drugs after 7 days of withdrawal. 3. Patients with a history of digestive tract diversion. 4. Patients with upper gastrointestinal stenosis, unable to expand. That is to say, gallstones can be treated with ERCP surgery.
But I have to attend an important meeting in a week. You can't stay in the hospital for long periods of time. Can I take some painkillers first?
Your current situation cannot be solved by taking medicine. It's embedded in the common bile duct. Jaundice is so high and still a hot topic. It's very possible will further deteriorate. Surgery is still recommended as soon as possible. You don't have high blood pressure, heart disease, other underlying medical conditions. It can be treated with ERCP surgery. ERCP is minimally invasive surgery. No need to cut. Recovery was fast. The hospital stay was short. I will be able to live a normal life soon. You go to the hospital first, then do a routine preoperative examination.
Well, then you can help me arrange the surgery ASAP.
Look at it now. Look at it now. It's much better than before. Hands and eyes are not so yellow anymore. The fever went down. Look at the report on transaminase, liver function indicators. The bilirubin index, serum amylase, and other indicators have basically returned to normal. How do you feel about yourself? Sample.
My stomach doesn't hurt anymore these days. Now I can get out of bed and move around freely. The nurse told me that I would be discharged tomorrow. I'll come back in a few days when I'm fully recovered, and to meet clients. Thank you so much.
You're welcome. Remember to adjust your schedule when you go back. Pay attention to the precautions on the doctor's order. Eat less spicy foods such as hot and sour, raw and cold, coffee, etc. Or don't eat high-fat foods such as egg yolks and fat meat. You'll have to eat a regular diet. If you feel unwell, come back for a follow-up visit.